Fox 26 News at 8. Your Gulf Coast Weather Authority.
In HealthWorks this morning at 8:21, heart disease, both a very deadly problem and it's very preventable as well. You may be surprised to learn how common it is in young women, but that is knowledge that could save a lot of lives. So let's work on that. Joining us this morning, Dr. Stephanie Coulter from St. Luke's Episcopal and Allyssa Smith, 21 years old, who became a heart patient just this spring. Good morning to you both.
Good morning.
Doctor, let me start with you. This is a common problem for women, really of all ages.
Well, actually, half of all women die of heart disease, so it's the most common cause of death in women.
The kinds of symptoms, and they're not necessarily the same that go with men, are what? And we have a graphic that goes along with this, but
Excellent.
But what should people be looking for?
Well, the manifestation, actually, probably for Allie, was shortness of breath and difficulty breathing, primarily with lying down flat. She probably had a nagging cough, particularly when she exercised, and she felt profound fatigue and inability to do her normal daily activities. And those are manifestations of a weakened heart muscle, which is really what Allie had. She had cardiomyopathy. The symptoms of what we think of as garden variety heart disease are related typically to underlying obstructive arterial disease like heart attacks. And the symptoms of obstructive heart disease are different between men and women. And the typical symptom would be of chest discomfort that's typically exercise related and that may be associated with shortness of breath or sweatiness or difficulty breathing.
So at such a young age, and we mentioned Allie's 21, and I'm going to talk to you in just a moment here. At such a young age, is it something that has been with the person since the beginning, or what?
That's a really great question, because in fact at such a young age they may have had like some congenital heart problem that went undiagnosed. Which was not the case in Allie's position, but it may be the case in others. But the symptoms direct the doctor toward an investigation that leads to, hopefully, the truth and a treatment plan. But with Allie, she actually got a virus, which weakened the muscle of her heart and led her to the Texas Heart Institute at St. Luke's Episcopal Hospital.
Allie, let me talk to you. 21 years old. You're supposed to be the picture of health at 21 years old.
Yeah.
So you get this virus, and they start doing this investigation, and it leads to your heart. You think, my goodness, what?
Not possible. I was in college, and I haven't yet to experience the full college life because I've had to be home. When in the beginning I didn't know how bad it was, so I came home for a year, and then when I decided to go back, it decides that I have to transfer from Baylor to St. Luke's, and Dr. Bogave, my cardiologist, was like, yeah, I'm gonna do everything we can before we even talk about transplants, and we tried everything to medicine. Your body has to just be able to take all the medicine, and I did good for 6 months, and then all of a sudden my body was like, nope, not gonna happen.
9 surgeries since then, so
yes.
And you'll forgive me, I don't know the full medical history. Did you get a heart transplant?
No.
Not necessary at this point.
Not right now. I'm on the list for a heart, but I'm so young that I have a left ventricular assist device, a heart pump, that actually I ended up having 2 because my first one had malfunctioned and I wasn't getting any blood flow. So they're going to do that, and then I'm still going to be on a bunch of medicines, and hopefully it'll give my heart a chance to grow stronger. Basically, start working on its own, and then we'll try an explant, take the pump out, and I'll still have my own heart.
It's a lot of medical knowledge that a 21-year-old probably ought not have about herself, but best of luck
Thank
to
you.
you.
Thank you.
And it's great to see you sitting here with a great smile and being able to enjoy the holidays. Doctor, ultimately it comes down to if you suspect something, talk to somebody, right?
Get a good diagnostic workup at a reputable center.
Starts from there.
Invaluable.
Excellent. Dr. Stephanie Coulter and Allyssa Smith, thank you very much. Appreciate your time and your wisdom this morning.